is life. Your health matters. You matter. Health begins in the spirit and the mind. Take time to love you. Live well. Be well.
Let's go!
Health matters to me.
Come on, get up, cause you tuned into the station for your morning motivation to get your education for your health and your spiritual needs.
Health matters to me.
Yeah, strong will to empower the people, to promote the peace, though. Positive attitudes, behavior, that's a lifelong dream goal.
Health matters to me.
Yeah, health matters and we're here to help you become a better you, to be the best you, the best version you can be.
Health matters to me.
Yeah, and it's time for this classic, fantastic food for your soul. Here's Jackie and Coach Patrick right here. Let's go.
Health matters to me.
Hello, everyone. Good morning and welcome to Help Matters with Jackie,
And Coach Patrick.
where your help matters every day, guys. So thank you guys for joining us this morning.
Yep. Listen, we want you to join us every Saturday right here at 9 a.m. as we bring you relevant information pertaining to your health and well-being. We'll have healthcare professionals and other professionals on the show to assist us in helping you to be the best you that you can be as it pertains to your health and well-being.
So, guys, you already know what to do. Go ahead on Facebook, like our page, Get Fit with Jackie Fitness, and go subscribe to our YouTube channel at Help Matters Jackie and Coach.
Yep. All right. Happy birthday, happy anniversary to everyone that's celebrating birthdays and anniversaries on this great month of November.
Yes, and I think we mentioned most of them last week.
We've
So
been getting them all.
again, happy birthday, happy anniversary.
You know who you are.
Celebrate your born day and your anniversary. If you're traveling, be safe out there. So, guys, you already know this is the month we bring. This week we bring on our sponsor, Dr. Dan Joliffe, Aiken Chiropractic. So he's going to be joining us this morning.
Yep. Looking forward to a great conversation with Dr. Dan as we talk about the Carpal Tunnel Syndrome and how chiropractic care can help that. But we want to acknowledge our sponsors, our partners, and our friends before we get to that point. Aiken Chiropractic, Dr. Dan, when your spine is aligned, your body is too. Aiken Chiropractic is located at 425 Lawrence Street, Northwest in Aiken, South Carolina. Their number is 803-641-9191, and their website is www.aikenchiropractic.com. To be a sponsor, a partner, or a friend of the show, you can call 706-592-8862. We would love for you to partner with her and come on board and help us do what we do every Saturday at 9 a.m.
All right, guys. So we don't think we have any Help Matters happening this morning. So we're going to go ahead and bring no other than Dr. Dan Joliffe on and talk about corners. Because that's very important, guys.
Yes,
That's when we sit down on screens and computers and head downs all the time. So this is going to be a great subject. So I hope you guys can get something out of this and learn from this and apply this to your lives. Hey, Dr. Dan, good morning. Good morning.
How you guys doing?
Hey, doing great.
Pretty good. Well, can't believe how nice the weather is, huh? It's still nice and this time of the year, it's still beautiful. So
I know.
Can't really complain about the weather. We seem to be doing just fine,
Right. We got some much needed rain, I tell you. We was dropping.
Yeah.
Right.
Gotta have some rain, though. Gotta have some rain. Well, it hasn't really rained a whole lot since the storm, but we need to have some as well. So, I'm okay with that. But today I thought we'd talk about a condition that seems to affect a lot of people. Actually, almost everybody can get this at some point in their lives, and that's what they call carpal tunnel syndrome. And I just thought I'd brush up on that and explain what that is and what you can do about it, and also can chiropractic actually help with that. So, we all tend to do all this electronics these days. We work with our hands. You're texting, you're using it, computers, cell phones, tablets, what have you. You just can't escape that stuff. So there's a lot of repetitive stuff that we do in our lives. And part of that can cause certain problems, and carpal tunnel happens to be one of those. So sometimes you end up having some symptoms of that, and it could be like feeling like people say like pins and needles, or
Yeah.
maybe the burning or the itching, or maybe the some nagging lack of strength, like you can't even lift the bottle, like you lift something and it drops down. So it can be pretty bad. It just depends, but usually the carpal tunnel gets worse over time. So there is time to do something about it, unless it's some kind of an accident, it happens right away. So, so what we need to talk about a little bit is, what really is the carpal tunnel, and I actually have some pictures in here. I'm not really sure if that's going to work out on our broadcast with the cameras and everything. But here's a anatomical picture. I know it kind of looks bright because it's on a tablet. Can you
Okay,
actually see it?
perfect. Yeah, you
All
can
right.
see it
So I
clear
just
right
want to,
there.
yeah, I'll show you right there a little bit. But that's really a picture from a textbook, what that anatomically looks like. So I'm gonna have to lower it down a little bit, but you
That's
see
perfect
that
right there. Mhm.
yeah, you see like here's a cross section of your wrist area, and you have some nerves over there that go through it, and there's also this blue stuff that goes on top of it, and then there's some stuff that branches up into your fingers like that. So the yellow stuff on this chart is the nerves, and in the case of the carpal tunnel, we're mostly talking about something called median nerve. There's other nerves, but this is the main one for the carpal tunnel. And some of this, stuff that goes across like a band. See, like a little white band over there. Can I just lift it up like that? Is that good?
Yeah.
The little white band, so that's a ligament that goes across where that tunnel is. So it's called a tunnel because there is like basically a little tunnel being formed right there within all the bones on the bottom, and there are carpal bones in there. There are 8 of them, and they're all different shape and size. And then there's this nerve that goes right through the middle over here, but there's also an artery as well. So the red thing you saw was actually an artery on that picture. So yellow is the nerve, red is the artery, and they're both called median nerve and the median artery. So, and the little band on top that's kind of in the white, that would be the ligament. They call that transverse carpal ligament, but you don't really need to know that, but that's what it is. So what happens is with repetitiveness, repetitive motion, and we do something all the time over and over, this stuff can get irritating. So several things happen there, like these carpal bones, which are on the bottom of this tunnel. There are 8 of them, and they can move. They can shift in the wrong position, and they can irritate, this area. The ligament itself can get injured. It can be inflamed, and that can also irritate, the nerve and the artery. So when that happens over time, the compression of the nerve and the artery can cause all the symptoms going into these fingers. And the symptoms could be, numbness, tingliness. So, numbness could be from the lack of blood flow in there as well. And then tingliness could be from compressing the nerve, also numbness as well. So there's, a lot of symptoms there, but that's in a nutshell what this thing, does. So it affects a lot of people. And I also brought another picture because the nerve is not just from the tunnel, the wrist itself. Can you see that? Hopefully.
Yeah, that's good.
Uh, so the yellow thing is the nerve, and you can see it comes out from the neck. So it comes out from the part of the spine that is in your neck area, and then it travels all the way down your arm. It goes around, below the shoulder there, it goes around the elbow, and then eventually through the wrist area and then the fingers. I just want to show that because that will be the path of that nerve. So, when it comes out from the spine in your neck area, those are called nerve roots. And they can be compressed as well because we have 7 bones in our neck. They're called vertebrae. The purpose of this vertebrae is to protect the spinal cord, which they do, but they move. And so with, things we do, repetitiveness, if you're using computers or texting on the phone, you tend to look down like this. And then eventually certain kind of motion over and over can cause these bones in your neck to misalign. And instead of moving freely and gently like they're supposed to, they end up going out of alignment, they're getting stuck. So you have immobility, you have joint fixation, and that causes irritation of the spinal nerves. So whatever that nerve goes to, once it comes out of the neck and it travels all the way down, that's also going to be affected. So with a carpal tunnel, you really have to look at more than just the wrist if you really want to, get rid of that and help somebody as well. So we call it kinetic chain. Kinetic chain means when you're doing certain motion, all of this is involved in the same motion. So the nerve traveling down from the neck, it comes out from the neck, it can be, compressed there. Then it goes around and just around the shoulder, like it's shown on that picture, between the clavicle and all that. So that can compress it as well. Then it goes near the elbow, and that can be also irritating it. And then, of course, at the wrist area, which is what I consider carpal tunnel. So there are 4 spots where the nerve, as it travels down, can be irritated. And all of those irritations can cause, those feelings like numbness and tingliness and, what have you. So we just really need to be aware of all of that. So, it's not just that simple. So, what will be like the symptoms of the carpal tunnel? Well, I mentioned a few, but it starts with tingliness, burning, weakness, loss of strength in the hand, wrist area. You can have sometimes sensation like your fingers are swollen, even though they're not swollen. You can feel that way. It can be pain that travels, to your shoulder as well. You can have problems with coordination and movement and holding things. You can drop glasses and stuff like that. And it could be difficulty to manipulate small things, like you can't snap your buttons or something like that. It can be difficulty making a fist. You can't even make the fist. It's hard to bend like that. And then some other muscles in the hand can lose their function. So all of that is coming from the same problem, and it gets worse over time. So it just depends how early you catch that. And a lot of the professions are at risk for developing this. So what would be some of the things people do that can bring in this kind of condition? Well, anybody working in any kind of construction, so like electricians, plumbers, carpenters, people doing the roofing, they do a lot of use with their hands and wrists and over the same motion, so they can come out with this pretty quickly. People working in manufacturing, like assembly line, packaging, heavy machinery operators, they all do repetitive stuff. Food service workers, like service people at restaurants, or bakers and bartenders, stuff like that, that's also repetitive. Beauty and personal care, like a hairstylist, cosmetologist, all those people like that, because they use their hands all day long. Computer related stuff, like my brother is a computer programmer and he had carpal tunnel more than once. And people that use computers and all that. Healthcare professionals, because we use our hands a lot, chiropractors can develop it too. But also dental hygienists, or even dentists, nurses, maybe even surgeons. And then how about entertainment professionals that are doing a lot of dancing or walking or whatever they do. Musicians, maybe they play instruments. So all of those professions are kind of at more of a risk for developing this kind of stuff.
That's pretty much everything, Dr. Dan.
Yeah, it's pretty much everything. But that's why I wanted to talk about it, because there's a lot of stuff that causes this.
Yes.
But there's other stuff that contributes to this as well, like people getting arthritic changes as they age. So arthritis can develop carpal tunnel, pregnancy sometimes, diabetes even, and risk factors are also like accidents or any kind of falls or kind of injury like that as well. So there's a lot of stuff they can do it. So what do we do about it now that we know what's going on? The key factor here is to start doing something about it early. So when somebody notices this doesn't feel right, they should do something before it gets a lot worse, because over time it can get worse. So the worse it gets, the longer it persists and it gets worse, the more we run out of options. There's more difficult things that we need to consider doing. Sorry. So if it's beginning stage and it's just kind of having some symptoms there, and chiropractic can help in that situation. So we can what we do. A few things we do. So we can chase that kinetic chain. We can check the neck area, make sure the nerve is not being irritated or pinched coming out of the neck. Then we need to check the extremity, the affected extremity, or both. Really, I do both anyway. So you would check the shoulder, and you need to adjust that joint. There are two joints in the shoulder. There's a glenohumeral joint and a acromioclavicular. And if you saw the picture a second ago, it goes beyond your clavicle or collarbone, and that connects to make the acromion clavicular joint, AC joint. So you got to make sure that's okay. That's not compressing. That's not messed up. Then you look down into the elbow. Elbow has a little tunnel right here as well. It's called tunnel of Guillain. That mostly affects the ulnar nerve, but median nerve is going to go through it. So make sure the elbow is not out of alignment as well. That's pretty easy to adjust as well. And then you get to the carpal tunnel itself. So all those 8 bones right here could be adjusted. And we adjust it and we, correct that. It's a totally different treatment than it is for the spine. For the spine, we're unlocking the joints, we're realigning the bones, the vertebrae, and we're taking pressure off the nerves. Here, we're basically separating them out. We're doing different kind of, movement there, and there are different ways to do this. I like to use my hands, and I adjust it with my hands. So, I check the whole kinetic chain, and then I end up with the wrist itself, and we adjust it as well. So, they can be adjusted. There are different moves to do that. And to me, I think the manual adjustment, is the best. If it's really kind of getting worse and it's kind of inflamed with the ligament that goes across, we can do something like ultrasound. So we have physiotherapeutical devices that we can use. One of them is ultrasound that I have in my office. Ultrasound works really well for this. Basically, the staff member has to do it. You use the ultrasonic, pedal here, and you just kind of move it around, and you have to use this gel for the conductivity purposes, and you just move it around like that for a number of time. I think it's 8 minutes is usually the treatment time for that. So it doesn't hurt or anything. You don't feel anything except a little bit of a heat, because the machine that makes ultrasonic waves gives off heat as a byproduct. So it it's not like really high, but that's why people, they think maybe it's the heat that does the work. Not really, it's the ultrasound you can hear, but that's what it does. And ultrasonic waves can, help that tissue actually heal. So it stimulates the tissue. It creates some energy called ATP, and then the mitochondria of the cells uses that energy, and then the body can actually heal itself and, grow some new cells and that kind of stuff. Gets stimulated by that. So that works pretty good as a therapeutic modality, but by itself, it's not really going to fix it by itself. You also have to move the bones and realign those, because they are compressing on the nerve and the artery as well. So you need to do both, So that's what I do.
Let me just interject real quick, because what I'm hearing you saying is that chiropractic care can help naturally without requiring surgery for the carpal tunnel. And I know a lot of people think that once you get that carpal tunnel, it requires surgery.
So that's what I was going to go into later. I mean, like I said, the chiropractic care can really help if it's kind of like in the beginning stages of carpal tunnel. Like if somebody waits for a long time and, it gets worse where they can't even move it, like you can't even touch it. They go, oh man, I can't even. Yeah. Well, that's too late for what I do. I mean, it's just too inflamed. It's too much scar tissue. It is gone. So what we got to do in that case, we have to send them to the orthopedic doctor or whoever, and they would then escalate it. And sometimes they do injections. That would be the next step. They do corticosteroid injections. They're trying to reduce the swelling. Sometimes that does the trick, And if that doesn't do the trick, then it's, possibility of a surgery. So what I do with surgery, there will be scar tissue that forms there over time with that irritation as the bones are irritating the the nerve over there, and also the ligament is injured. The body will respond to the irritation. It will build more tissue there, which is ligamentous type tissue that's not elastic. That's a scar tissue. So the scar tissue compresses on the artery and the nerve as well. I mean, you have to remove that irritation. So we can't do that. So that's done with surgery. And then, they would simply, it's a simple surgery. they will make an incision somewhere here, and they will use this tool, and they will pull that out and clear that out, and it will be like immediate difference. However, even if you do surgery, if it's that far gone and you have to remove all that scar tissue, they don't realign the bones, they don't do anything. They just remove that scar tissue and that relieves the tension. If you do nothing after that,
Right.
that's going to come back. And I had patients that came to me over the years and they had 2 or 3 surgeries for carpal tunnel. And they're tired of that. And they go, man, I don't want to have surgery every 3 years. Is there something you can do? Yeah, there is a lot we can do. But just, we got to educate people. What is it that's causing this? And what can be done so that doesn't, return. So they have to maintain their body. They have to really be careful with what they do from that point on and make sure they do not get back to the same way. So if you do nothing, if your life doesn't change, you don't change what you do, you don't do any exercising, any stretching, I'm going to show that as well. Basically, it's going to continue to irritate. It's going to keep coming back. So, you know what they say, the definition of insanity is, right? It's in a dictionary. You do the same thing over and over, but expect different results. Okay. So something's got to change. And you can't use surgery as just like a little clutch over there. You really, it's not good to do just surgeries every so often. I mean, once it's enough, but you keep doing it, 2, 3 times. Well, you're doing something wrong in your life, You have to be
and here's
educated.
the thing: when you get the chiropractic care, you get to the root of the problem. And you
Exactly.
actually fix it. So
Well, exactly. I mean, that's what we educate people on. We tell them what to do. We give them some stretching. And then if they come for regular chiropractic care, this is exactly why I adjust the whole body, including the extremities. I think it's important to check the extremities and adjust them if necessary. You don't maybe need so much treatment so after a while, but when they come every so often, I would check everything. I would check the wrists. I would check the elbows. I would check the shoulders. I check the ankles. I just do those things regularly because that kind of gets stuck out of place with activities that we do, So, you got to be careful. I have a gentleman that comes to see me almost weekly, and he's a bodybuilder. And actually, I'm really proud of him. Just like 3, 4 weeks ago, he was at a competition, and he's in his 50s, and he lifted over 550 something pounds, deadlift that. And he weighs like 220 something, 30 pounds. So that's almost like half his weight. I mean, twice his weight there. And, he's pretty cool. So he says next time he's going for 600 pounds. So he actually holds the state record of South Carolina for deadlifting in his age category right now. He's the highest lifter. But he comes to get adjusted. I adjust him, and then I do his wrists all the time. And he's doing this every time he comes because he's lifting so much weight that he's compressing these joints all the time. And he comes and does this because they're going numb. So I adjust that every time, but he keeps doing that. And that's really, I'm glad he's exercising, but maybe that's too much, maybe that much kind of weight.
That's what I was getting ready to say, Dr. Dan. If you fix the problem, then you keep going back to the same things that is aggravating and causing it. So maybe it's time to just I didn't prove what I need to prove.
That's it. That's it. So you don't have to. We don't all have to be bodybuilders to be healthy. Right. But that's what he chose us to do. Right. But the point is, yes. There will be surgery at some point if this is not nipped in the butt, so to speak, early on. Now, what can we do as far as there's some exercising and stretching exercises to help with that. And I always tell patients what to do at home. So, a couple of those things I'm going to show you right here. So you want to stretch these joints right here. So a couple of things you can do. You can go like this, put the arm straight. I'll just make sure I'm on the screen here. And then you pull with the other hand, like the fingers like that. And you have to feel a burn here. If you don't feel a burn here, you're not doing it right. So keep the arm straight and just pull on it like this. And you hold that for 5 seconds. So you will count, 1,000 up until 5,000. That's about 5 seconds. You let it go, maybe stretch it a little bit, and repeat it. So I tell them to repeat it either 3 to 5 times, whatever makes them comfortable. But, you got to do it 5 times, and then you repeat it. Now, you do the other one. You do both. You should do both, because if you're getting carpal tunnel in one hand, the other one's not too far off either, because when one is getting bad, people tend to then use the other hand to overdo it because this one is bothering them, so they do it more with the other one. They're gonna have carpal tunnel in both hands. So stretch them like that. Once you do that, so that's a good stretch right there. Another thing you can do is you go like this. You put them against each other and kind of bend them like this, kind of keep them as straight as possible. So you stretched it like in this direction from this direction, but then you have to go the opposite direction and just hold it like that. And you hold it like that for 5 seconds approximately as well. Let it go for a little bit and then repeat it 3 to 5 times just like you did the other one.
Oh, you
I mean,
really
this
feel
doesn't take
that.
long.
Yeah.
Feels
Yeah,
good.
you can feel it.
Good.
So do that. If you feel it, you're doing fine. If you're not feeling it, you're just playing around. So I don't feel it like this at all. But when I do this, now I feel it. I mean, you don't want to hurt yourself, but I mean, you got to feel it. And so that
So
one
basically
and
5
that one.
reps, 5 seconds. 5 reps,
Yes,
5
5
seconds. 5 and
seconds,
5.
and then try to repeat it up to 5 times each. So the thing is with this one, you got to do each hand separate. This one, you're doing both hands at the same time, so it saves you time. And then another thing you can do, I don't have it, but you can take like one of those little stress balls or maybe an old tennis
Yeah.
ball and
Yeah.
just kind of keep squeezing it. Keep squeezing it. Let's watch TV or something. If you do when I do this, let me see. You can see my tendons are kind of
It's
firing
it
off
moving.
right here when I
Mhm.
do that. And
It's on.
that's actually helping that area. So you just, watch TV or something and just squeeze that for a little bit. Also you can go to, Walmart or somewhere and buy like a little weight, like a little spring thing that goes like this. And you can
Yes.
use that
You
as
should
well,
help me
to
those.
exercise like that. They have that as well. It's like metal with a couple of handles. You can keep doing that. Whatever you
Mhm.
do, you want to exercise this area right here. So you do that for, a few minutes. I mean, whatever you can do. So that's a good thing. If it gets really bad, before you go see somebody professionally, you can go to like CVS or somewhere or Walmart or Walgreens and buy their little cream called BioFreeze. BioFreeze is a natural pain reliever. So I think it's a really good thing. We also sell it in my office. A lot of doctors' offices, have that. So you can buy it anywhere. And you can just, rub it right there where the carpal tunnel is, like right here, maybe even on the other side. Just rub it a little bit and let it be, and then wait 2 or 3 hours and do a little bit more. I mean, it's just a natural gel. It smells like toothpaste because there's some menthol in it, but there is no chemicals in it. It's all natural. And it will help with that, swelling a little bit. So again, it's not going to fix it by itself, but it will give you a little extra time. And if you do get adjusted and get that stuff, better, you should follow at home with those exercises, maybe using some biofeeds and stuff like that. It will eventually go away.
Cool.
So, carpal tunnel, I don't know. It depends how long person had it, how bad it is. I mean, depends how many times I got to adjust them. I mean, in my office, most people get better between 6 and 12 treatments. That's what I see with a lot of things. Same thing here. I mean, sometimes you adjust somebody one time and they're like, oh man, that worked great. Sometimes it takes more than once. It just depends where they are and how their body works and how they respond. But it's not like forever. It's just, several times. And because of that, we give them that Power Wellness program where they get 4 treatments for $79. So that's under $20 a visit. So
Yeah.
they can afford to come at least 4 times and
Awesome.
get it better and then go from there. So that's why we do it. Also, the Power Wellness program includes 1 therapy. So if my staff needs to do ultrasound on the wrist or something like that, that's included. There's no extra charge. So really, it's as affordable as it can be.
It's
And we
great.
we uh, we
Great
kind of do
price.
that. Yeah,
Great price
it
for
is.
great
Yeah.
service. Yeah.
Especially in
It really
these times.
it really is.
Very
Prices are going
affordable.
up, but right now my prices are good, and I don't plan on raising them, anytime soon. So hopefully we'll be fine. But it's probably the best deal out there. But shop around, see who's got a better
Yeah.
deal.
And
But anyway, that's. Mhm.
Go ahead, Dr. Dan.
I was gonna say that's what we do for the carpal tunnel, but keep in mind there is more than just the wrist. A lot of times in the body where you feel the pain or feel the issue, there is more than that. Because everything is interconnected. It's like show you
Mhm.
that an anatomical picture how the nerve comes through the neck and travels
Mhm.
down the arm and everything. I wanted you to visualize that because that's the truth of it. I mean, you can have a pain numbness in your fingers and we can treat the wrist, but we really have to check the other parts of the kinetic chain, and also that includes the cervical area. So when they come for carpal tunnel, I can take an X-ray of the carpal tunnel if they're concerned, but I usually want to look at the spine, the cervical spine, because that shows me some misalignment. It is unusual that somebody would just have a carpal tunnel, but nothing else is wrong. It can happen, I guess, but it's rare. So, I would be very detail oriented. I would do all of that. And again, I don't charge anything extra. Whatever I do per visit. But that's kind of what we do. We try to check the whole thing and make sure everything is, because it's all related to one another. So you really have to be kind of digging a little deeper like a detective and take away all their obstruction. Body heals itself, but you have to take away the obstruction. So for me, I'm moving those bones. They're pressing on the nerves and all this other stuff. And that's the way I take the obstruction out of the way. If you let it go so long and your body develops some scar tissue that's now sitting on the nerve and the artery, you got to have surgery. And they remove the obstruction by removing the scar tissue and let it heal on its own as well. So really, your body heals itself regardless. We just have different things we do to remove the obstruction, but that's really the treatment for all of these things. So, the idea is with all this stuff we do here on the podcast is to educate people. Education
Right.
is the key. So once you know what it is, hopefully you'll take the proper steps to, correct it and not have to keep doing surgery after surgery or what have you. And also to make sure that you prevent that from happening. Prevention is the
There you
best
go.
cure there is, so do those exercises. Be careful when you do a repetitive motion if you can help it. And I'm telling you, I see young kids come to my office. You can't prime away from those cell phones. They're, clenching the cell phones like for dear life. It's
Yeah.
incredible what goes on. It really is.
Mhm.
So, leave it be. I'm old enough that we didn't grow up with a cell phone. So I don't even carry the cell phone in the office because I can't. I do have a watch. I don't have it on now because I was going to show you the carpal tunnel and all that. But I have one of those smart watches. So if somebody calls me or leaves me a voicemail or send me an email or text, I can see it on my watch. But I can't answer it when I'm working. I just can't do it. I mean, just in case there's an emergency, I have it. But I don't really carry the phone, and I feel relieved.
Mhm.
I feel like I'm free.
Yeah, we can get
You don't.
attached to those electronics. We really
Yeah,
can.
we don't
Yes.
have to be doing that all the time, but
So,
you tell somebody that's teenager, they just can't let it go. So
Mm-mm.
that's just our
Yeah.
society issue, first
Yeah.
world issue, right? So
Yeah.
we have
And,
too many gizmos around.
some of the things, Dr. Dan, you talked about the bodybuilder, that's I've been into that for a long, long, long time. We don't think about uh the effects that we're gonna have later and how we train
Oh yeah,
early in life and
as
how
you
we train
age,
as we
yeah.
age, how these things. And I thought about that. I said, well, maybe that's his body telling him to, that's enough. It's time to
yeah,
shift. It's time to shift something. And but his mindset, I
yeah,
done set this goal. I want to do this, but your body is saying,
yeah,
your mind may be going there,
yeah,
but your body is, you
yeah,
can do it, but you putting your body at
yeah.
risk. I
Well,
think so.
I'm proud of him that he can do
Yeah.
that at in the 50s, and that's pretty cool. And I told him, I said, when you see them bodybuilding or whatever, they have those things they put around the wrist that tie him down to keep it from, coming out and all that stuff. And he uses all that, but he's lifting so much weight that I'm not sure if that's really helping at that
Yeah.
level. So that's just what I call professional deformation, I guess.
Oh yeah.
Yeah.
But hey, at least he's
Absolutely.
doing something healthy. I mean, he's lifting weights and he likes that. And who am I to say anything? I just keep doing what I do and keeping going. And I'm happy that he's accomplished what he set up to accomplish. And that's the thing, mind can accomplish everything. Once we set up our mind to do something, it's just there's no limit to what we
Right.
can do, really.
Right.
So. But
And
the
as and
education is the key. You
uh,
need to know how to do something so it's done
right,
the right way. I mean,
right,
we can probably save a lot of money as a whole society if we educate people to prevent injury by doing certain things. You will
Right.
see there will not be the healthcare system in this country will not be so expensive. But it's just incredible. We make same mistakes over and over as a society. It always
Right.
amazes me how I would say that living in the United States and being from Europe and seeing other countries, we really have some of the best roads in the world. I mean, we have the best roads. They're also wider. They're also bigger. And we probably have the best cars. I mean, they're all automatic and, can pretty much drive themselves. And yet we still have car accidents all the time.
all the
It's
time.
incredible to me that people don't pay attention and they just,
So many distractions.
always distracted constantly. All of that can be prevented. So I don't know what to do about that, but it's just incredible. Just the other day, I treated a patient who was in a car accident, and he came a few times, and he comes the other day with his hand wrapped up. He's like, he's a broken hand. I'm like,
Wow.
what's happened now? He goes, I was in a second car accident
Wow.
just the other day.
Um,
That happens. They come here to be treated for one accident, and while they're treating for that, they get injured in another one. I
Wow.
mean, that blows my
So
mind. But
that's keeping you busy.
it keeps us busy. But I really wish
you
that didn't
never
happen. I
stand
mean,
up.
that's
Yeah,
Yes,
yeah.
that's
So
yeah,
it.
Dr. Dan,
it's
women, do
amazing.
women get carpal tunnel syndrome more than men, more often than men?
I couldn't hear.
Does women get carpal tunnel
Oh,
syndrome more often than men?
I do not really know. I don't really know that statistic. That's
I've
something to
read
look
that
into.
somewhere. Yeah, I've
Yeah,
read that somewhere. That's why I asked. I read
yes,
somewhere that women get carpal tunnel syndrome about three
yeah,
times more often than
I
men
think
do.
we do more typing.
probably.
Yeah,
Probably do more stuff with your hands and stuff. Plus,
yes,
there's another thing.
we cook a
The
lot. Yeah,
Right. The
so we do
women's
more.
anatomy, the women's anatomy in general is a little different than men's. Like you don't have as much muscles and all that stuff. So, maybe it doesn't take as much of that repetitive and stuff to get out of whack, so to speak. It's possible as well. I don't know, but there's a difference in anatomy there as well. So
Mhm.
maybe I would believe if that's really the case, but I would say anybody can get carpal tunnel. I mean,
Oh
that's
yeah, anybody can get it.
that's
It's a common, condition that
that's a given. That's a
yeah.
given, absolutely. So, hey, try to prevent it. Try to be safe about it. Don't overdo things, give it a break. If it kind of starts to bother you, well, do those stretches first and maybe use some biofreeze, what have you. And if that doesn't solve it, if it keeps getting worse, then seek professional help, I would say. And don't go for surgery right away. Surgery should be the
Right.
last thing you do.
The
You
last
try
result.
yeah, you try what I call conservative care first because there's no side effects. I mean, this is all natural stuff. And
Right.
if that doesn't work, then you start with, injections. And if that doesn't work, then you do the surgery. Don't skip the step because, maybe something else will help you. It will
Right.
save you a lot of money, a lot of aggravation. But if it's up to that level, well, then you got to do it. It
Right.
is what it is,
Yes,
just, oh,
I went to the doctor a couple of weeks ago, and I developed a heel spur
yeah.
and it was real bad in my right heel. And I
Hmm.
like the podiatrist because that's what she did. She said, we're just gonna do these rehab exercises. And I, when I was younger, I had one, but I rehabbed myself.
Hmm.
So she gave me same exercises to do. And she said, the next result, I go back in December. She said the next would be a shot. She said, if that don't work,
Hmm.
then, surgery. She said, but we're gonna go this step. So when you said that,
Yeah.
she was not so quick to,
Yeah.
give me a
Surgery.
shot or surgery. So I was glad that I was gonna take it anyway, but I was gonna,
Yeah.
she said, because it's only been a few months, it ain't been
Yeah.
years. I just been sitting here dealing with
That's
this.
good.
So she said that's a good thing.
Well, any doctor should do the easier steps first. It's
Right.
easier, it's non-invasive, and do those first. And if that doesn't work, then you have to escalate it. And yes, then it's time for the injections. And if
It's
that
more
doesn't
invasive.
help you, then it's when you have to be invasive. And
Right.
but we can talk about the heel spurs as well. That's another thing that we can actually help in chiropractic as well, depending on how bad it is and all that. But heel spurs are more difficult, I would say, than carpal tunnel because it's on the bottom of your foot and you are walking on it every day. You have to
Right.
walk on it. Like you can relax these guys here, but you have to walk on your feet. So
Right.
that makes it more difficult because you have a possibility of re-aggravating that as you walk, and so that's why those things are kind of annoying and they have a really big tendency to keep coming back. So heel spurs are nothing to that's pretty serious, pretty serious stuff. And so we can talk about that in one of these episodes as well. But
No
yeah,
doubt.
they're pretty difficult as well. But yeah, listen to your doctor, do those exercises that she or he recommends, and then see about what else can happen. But I would say you have to realign their bones in your foot that also need to be realigned. So that's calcaneus, which is your heel, and then also the metatarsals as well, because that's where the ligament goes down there. And
Mhm.
there's also talus, and there's also navicular, and some three bones called cuneiforms. I adjust it in patients all the time, and that's why we do it. And a lot of women get heel spurs for sure because of the footwear. Women
Yeah,
like to
I
have
just to
heels
say
and
the
all that.
heels and the shoes.
Yeah, yeah. So less heels, less chance of that stuff. That's why men don't get it as much, but women do. And one of the studies I read, and that was some time ago. I can't really quote the study. I mean, where it was, but the study basically said it was a medical study. Basically said even if it's just a 2-inch heel, 2 inches is enough to misalign the bones in your foot, and it will
Wow.
cause undue stress on your ligaments and all the other stuff. And what's 2 inches? That's not that big. A lot of women you see much bigger heels than that. So
Mhm.
you should wear flats, but it's not just flats. You should wear comfortable supporting shoes for that, like sneakers. Something good, and also socks. And I see in the summertime, especially down south, you see a lot of women wearing those little flip flops. They are super thin. They are terrible for you, terrible. They keep all those doctors in business because they all end up having problems with their feet. And
Yeah.
so that's a whole topic for another discussion.
I
Yeah,
But
know, talking
we
about the
will.
right
That one.
shoes,
yeah,
because I have
they
to go
really,
down to Fleet Feet to get some
yeah,
shoes. Yeah,
yeah. You
yeah.
got to really do something, good. I personally, because I'm on my feet a lot when I work, I wear sneakers at work. I don't even wear dress shoes. I used to, and my feet were hurt at the end of the day. And then I realized, oops, I should wear. So, a few years ago, I started wearing Brooks. I have Brooks, and they're just
Good
excellent.
too.
I,
Yeah.
Yeah,
I
that's
can't
the
say
one
how
she
good they are.
recommended, Brooks, for
Yeah,
me.
I like Brooks, but I mean, there's other brands. I'm sure they're just as good.
Yeah.
But Brooks is what I wear, and my feet don't hurt at the end of the day. But there's other things too, like around my adjusting tables where I work. I have this carpet and everything, so that kind of cushions where I'm standing. And around my clinics in Augusta and Evans, I put this like a memory foam kind of thing, padding around it. And the doctors are saying, "Oh yeah, this is really good." So that's what we do. You have to have the cushioning. You have to have good footwear and some really nice, socks. They're thick. If you're just doing it for looks, well, that's
Yeah.
going to cause problems.
Yeah.
So
You have to
uh,
suffer the comfortable shoes
exactly,
you're trying to take
Right.
the
exactly.
look. So, Dr. Dan, you know where we're at. We're at that time again. What
Yep.
you got that you want to close out with? Anything you want to close out with?
Well, I mean, we just mentioned the Power Wellness, so we still do Power Wellness program, and it's really, I don't know if it's any better deal anywhere. So you have 4 treatments or 4 visits for $79 for that, and then that includes one therapy. So some people choose to use massage chairs that we have before the treatment, or you can use like ultrasound or electric muscle stimulation or roller tables. There's all kinds of stuff we have that we recommend if it's necessary. And some people just go get adjusted and leave. So it depends on what you want to do. But we do have that. Also, I take insurance. I mean, I'm a provider for Medicare and all that stuff too. And I do personal injury as well. But, Power Wellness, I think, helps a lot of people. So, see us, acrechiropractic.com. You can also make appointment on the website, or you can just call us, 803-641-9191. And we're right on, Lawrence Street downtown, Main Street.
All
Awesome.
right.
All right, Dr. Dan. Good to see you
Good to
again.
see you
Yeah,
again. Great conversation as always.
As always, learned a
fun.
lot about carpal tunnel today, and I tell you,
Yeah,
it's good to know that we have an option. And well, as long as we do something about it,
that's the thing.
don't just wait and let it
Don't
get
let it go
worse.
too long.
Yeah. All right. Well, you guys have a great Thanksgiving.
Yeah.
Yeah, yeah. You gonna
So
Well,
travel
thank you.
for
I guess I'll
Thanksgiving
see you after the holiday. So happy Thanksgiving to everybody. Eat
yeah.
early.
Okay. All
Yes.
right, Dr. Dan.
All right, Dr. Dan. Tell everyone to
Bye.
say hello. All right.
Absolutely. Bye.
Bye bye.
Bye bye. Awesome. Good stuff. It's just good. Like I was saying, it's good to know that there's options. Carpal tunnel syndrome.
Yeah.
Can be a progressive condition, but it's good to know that you can. Chiropractic
Prevent it.
care,
And
can help.
and we don't realize when we're younger, we wearing these heels and all these flip-flops and how this stuff's gonna affect us later,
We
So
got to talk about them feet. Huh?
we just got to talk about them feet because we think because they cute and they look good. They don't mean they gonna help sustain you and help you in the long
Well, see, that's the risk that some women take. Just like we talked about the bodybuilder, that's the risk that people take because they
right.
want to do a certain thing,
Yeah,
which is okay.
because the body eventually will begin to
Yeah.
start telling you need to pull back or it's time to let it go, and it's hard to hard to do that. But yes, I think we need to talk about the feet.
Yeah.
Yeah.
All right. So we hope everybody got something out of this on today. I know I certainly did.
Oh,
Talking
absolutely.
about carpal tunnel syndrome. So listen, we want you guys to continue to tune in on Saturdays at 9 a.m. Make sure you like, make sure you subscribe, and pass the word and share the channel so we can even help even more people and make them
Right.
aware of, things, all health and wellness. So thank you for listening to Health Matters with Jackie and Coach. We want you to like our Facebook page at Get Fit with Jackie Fitness and subscribe to our YouTube channel at Health Matters Jackie and Coach.
All right, guys. Remember, we're here to help you to become a better you, to be the best you that you can be. We like to leave you with 3 John 2. I wish above that all things that you may prosper and be in good health, even as your soul prosper, guys. Guys, remember, if you're not doing anything today, come out to 2404 Tobacco Road to Harvesting Health, 10 to 2. Guys, come out, learn a lot about your health. This is a great way for prevention. We're going to have a lot of free screening. So, guys, come on out. We're going to have food vendors on site. We're going to have bouncy houses, and Lightning McQueen will be on site from the movie Car. So come on out. Bring the kids out. Men, let's man up. Come on out.
Want to see you, brothers. Come on out.
We want to see your brothers. We want to see you show up.
We got to take care of ourselves too.
Yes. So, guys, you have a blessed and healthy and safe day.
Health is life. Your health matters. You matter. Health begins in the spirit and the mind. Take time to love you. Live well. Be well.
Yeah, let's go.
Health matters to me.
Come on, get up, cause you tuned into the station for your morning motivation to get your education for your health and your spiritual needs.
Health matters to me.
Yeah, strong will to empower the people, to promote the peace, though. Positive attitudes, behavior, that's a lifelong dream goals.
Health matters to me.
Yeah, health matters and we're here to help you become a better you, to be the best you, the best version you can be.
Health matters to me.
Yeah, and it's time for this classic, fantastic food for your soul. Here's Jackie and Coach Patrick right here. Let's go.
Health matters to me.